You go live. Starting live. Here we go. We are live. So thank you for joining us on YouTube Live. I have to do a little bit of extra work here behind the scenes to try to be able to see your comments because I'm using a different system this evening. So while you guys are coming on and telling me where you're from, I'm going to be working on an iPad here to find our live feed, which will have all of your comments, because I want to be able to respond to your comments. So let me see if I can find that. And it's not giving it to me just yet. We'll go to the Auburn Medical Group page here. And so you guys can play along at home by looking at the comments and reading them. There we go. Motivated to live healthy. I found the title because I wanted to talk about healthy living and trying to motivate patients to live healthy. And I wanted to get some of your feedback on what works for you, or what would work, or what just never will work for some of you. Okay, there we go. I have it. I'm looking for where the comments would be. Probably a little bit delayed, so if you guys go ahead and give me your comments, I will be looking at the monitor here to read your comments so I can respond to them. And I may even need to look down at the bottom to find where the comments are going to be. I know there's a number of you watching. I do see that. What I don't see, though, are where the comments show up. So give me a little bit of time here. Still looking for where it gives you the comments on this thing. So I'm going to hit a little button here, hit a little button there. And this has happened before when we've tried to do more than one person on, like when I had Dr. Gwain on, and it was quite a bit of work to try to find where the comments actually live. I have an iPad and, oh, there it is, live chat. There we go. Okay, I'm going to read your comments. Oh my goodness, look at all you people. We've got Sakura, and we've got Al High, we got Jessica Harkland, Norma Jean Green, Miranda, Lauren E, LaDonna Dias, D'Angelo, Devonna, Peggy, Kimberly, Charlotte, Norma Jean Green, Sakura, Sue Polly, Kelly, and of course, Audrey Bunch. Hello. Thank you. Okay, so I feel like I've been greeted properly with all of those people. Thanks a lot. What we want to do next is talk about the subject of motivating the patients to live a healthy lifestyle. This comes from two very different experiences that I've had in the last week. I had one patient who did a remarkable job of changing his lifestyle so that he actually, at our last visit, got off of blood pressure medicine. An incredible thing to see, a person who now has normal blood pressure, normal body weight. He looks healthy, looks good, and he's just starting a new life. He didn't always live like this. This is a new thing for him. He got motivated somehow to do it. So let me look at your comments here since Audrey said hello. Hi, Audrey. We have Jessica Harkland. Baby girl has acne with natural treatment. Can one and huff. Jesus Rivera Torres, I want to ask you about cure for urinary tract infection. Kelly Almzo, drink lots of fluids. Kelly Almzo at Jesus. Hi to Carrion. Jesus, thanks. El D'Angelo, water, only drink water. Jessica Harkland and Jesus, thanks. Certainly, given that you guys aren't responding to the healthy lifestyle, we can respond to the UTI. Urinary tract infections can resolve themselves. There are also things that can appear to be urinary tract infections that aren't, like cancer and other causes of bleeding in the urinary tract that can cause burning and discoloration of urine and foul smell to the urine. Also, you can have diabetes that causes frequent urination, both diabetes insipidus and diabetes mellitus, the sugar diabetes and the diabetes caused by abnormalities in the kidneys regulating electrolytes. So the first thing I say is when somebody has a urinary tract infection is how was it diagnosed? We diagnose a urinary tract infection by finding evidence of bacteria causing an infection inside of the bladder, not just by symptoms alone. Because there's so many other things that can cause symptoms that mimic urinary tract infections. And then we use antibiotics to treat bacterial urinary tract infections. Some people use the cranberry juice. The problem is so many people overdo the cranberry juice and cause what's called a chemical cystitis that mimics the effects of a urinary tract infection. So they'll have burning when they urinate and have to go frequently because of changing the pH too much in their urine. Okay, so enough about that. Lauren E. Somebody's addicted to Pepsi. Audrey, you're addicted to Pepsi. Okay, well, it is hard to give something like that. And the reason is because bad food is addictive. The effects that the sugars and the oils have on our neurotransmitters reward us like drugs do, and so we want them. I have personally experienced this with wanting to finish off a package of Oreos, or always just finishing off the bag of Doritos or some other chips, because it drives you to keep eating. You have to not even start them. Don't even have those foods in your house. That is the best way. Now, do I never, ever eat something that's not on the good list? No. If I go to somebody else's house and I'm their guest, I eat what is put before me without raising questions of conscience. And I enjoy it. But for myself, when I'm deciding what the food is, I don't have those things around. And I'm really getting better about not missing it. If I smell bacon like I did this weekend, my mind goes back to how much I enjoyed bacon. But I don't want to put that in my body. A class 1 carcinogen, no thank you. We don't do that with other things. At least most people, when they're thinking about it, don't. Bring me to something else I'm wanting to take on, and you guys can do this with me. The book Fast and Slow, Thinking Fast and Slow, was recommended by the president of Westmont College last time we were down there, talking about how decisions that we make on impulse or on intuition really do bad things for us compared to when we think things out overall. So if anybody wants to go through that with me, we can have like book club with live YouTube on that sort of, because it does impact health. Right here, we're talking about thinking about what we eat instead of just eating whatever. So let's get back to your comments here. Do you have any recommendations for natural treatment for my 1.5 to less diagnosed with inflamed gallbladder and stones, trying to eat healthy? Gallbladder, yes, that's one where diet really makes a difference. And there are some, so-called natural cures. I have seen patients end up with actually resolved stones on ultrasound scan after doing this lemon juice and olive oil diet. You can look it up to find the details of it. Scares me to death, the idea of having a whole bunch of olive oil at once, which stimulates contraction of the bile ducts and the gallbladder. Sounds like something's going to exacerbate pain from stones in your gallbladder. But if people want to avoid surgery, they'll try it. We have Faith O. Say hi, Faith. Hi, Faith. And also more earwax videos. Sue Polly. Hey, Dr. V, you can recommend helping change a healthier lifestyle with fibromyalgia. That's a good one. The number one thing for fibromyalgia is physical activity, being physically active. Dr. Elaine Lambert at Stanford University told me, she's a rheumatologist there and a shirt tail relative to boot. She told me that she had a patient who was training for Olympics, was a swimmer, and had fibromyalgia. Now, somebody with fibromyalgia that hasn't discovered physical activity being helpful would just cringe at the thought of the kind of exertion and exercise and movement that would be required for that kind of training. The truth is, when this person was at the peak of their training, their fibromyalgia was the best controlled and they had the least pain. Hard to get to that point, though, when you hurt. So that's why I recommend that people do go ahead and talk to their doctor about, yes, medicines, because there's some that really do help to get you to a place where you can move so that hopefully you can later get off of the medicines. And I hate to say this is so different from what Dr. Green Knight was saying in his blog this week, which I agree with totally. But fibromyalgia pain is one of those things where a person may be on 3 different medicines for a single problem to get them to a place where they can get off of the medicines. Sometimes medicines help us to get to a place where we don't need medicines. Okay, going back to your comments over here. Sorry, usually I'm reading the comments right here and I'm looking right at you guys when I read them, but with this new system, I'm not. And you may wonder why the new system. Well, the new system will allow us to do multi-camera live broadcasts of procedures from the office. That's what we're working toward. We almost did it the first day we got the system this week, but it was just too much to put it all together. And I believe the patient was a surprise in that he did not want to participate in video. And it was an earwax removal. Sorry. That would have been fun to have the multi-camera with the camera, because it works with the iPhone camera. That's what I'm using now with it. So getting back to, oh, Faith, thank me. Yes, you bet. Thank Audrey. Diet sodas versus regular. You know, it's better to not have either. Diet soda has not been the wonderful thing that you would think it is, in that you're not getting calories, but you're still getting all of those other things that are in there, particularly the ones that contain the phosphoric acid, like Coke, Diet Coke, Pepsi, Diet Pepsi. I don't know if Dr. Pepper has it. Some of the root beers have phosphoric acid. Usually it's the darker colas. And we know that that's hard on the kidneys. We know that people who drink even diet colas on a regular basis, 2 drinks a day. There's a study specifically on women that found that the ones that were drinking 2 colas a day this is over decades, had a significantly higher incidence of kidney disease. And some of these people were on dialysis. So don't put that stuff in your body. I will say that when I go on a long trip and I want a stimulant so that I don't have a greater health hazard of falling asleep while I'm driving my family in the car, I will choose to drink a caffeinated beverage, and the drink of my choice has been a Diet Mountain Dew on those. But we're talking a bottle every couple months, maybe, for a trip. Lately, the Dutch Brothers has been doing the job, so I haven't had to do that. And sorry to all of you that, no, I shouldn't say that. I shouldn't say sorry to all of you that don't live in Dutch Brothers territory, because you're able to probably be healthier for it, because a lot of it is not the healthiest. Just lost my endorsement. Oh, let's see. BooBoo Kitty's responding to somebody else. And Kimberly, if you get rid of... Oh, BooBoo, we need to have our Google Hangout this month. Probably next week, if that works with you. Let me know in the comments. Can witch hazel help, or is it harsh? You know, I actually don't personally recommend witch hazel for anything, but that's not because of it necessarily being a bad thing. Well, okay, yeah, we do use it for postpartum, you know, after people have had the tears with their episiotomies, or tears or episiotomies, I should say. That's a place where we use it. Other injuries to the bottom parts, but I actually haven't read a whole lot on witch hazel, so I'm not qualified to comment on it. And carrying RD, also slow metabolism. Miranda, my cardiologist has me drink Mountain Dew every day for my migraines. Interesting that's a cardiologist, because a cardiologist would typically be the doctor who would not have you drinking Mountain Dew. And the reason is because, okay, let me change this here. The reason, I'm not doing this correctly. There we go. This is going to be fun. Watch this. The reason is because Mountain Dew is a stimulant and actually can be toxic to the heart. But there's places where that would be a good thing. So you guys just saw the cool thing there, that we've got the ability to put lower thirds on, so we can tell you who it is we have. Like I made one up for Dr. Fife and Dr. Trauner, who have been guests on our channel. So I thought that was pretty good. Let me see if there's a way that I can take that away. Make it go away. There. Pretty cool, huh? All right, back to your comments. Doctor, what are the healthiest meals? Have a good diet, and how many times a week can a person do exercise? We currently have a recommendation for people to get 150 minutes of aerobic exercise, and that you can do an online calculator to calculate your target heart rate. And this is for people who are in decent health, even though they may not be getting their exercise yet. People with health problems, consult your doctor before starting an exercise program and get in that heart rate. We want you to do exercise like that, 150 minutes. So that'd be like 30 minutes 5 days a week, or 50 minutes 3 days a week. That's kind of a number that we throw out there. BooBoo says next week will be perfect, Dr. Vaughan. Hit me up on Messenger with the date. You betcha. Miranda has POTS, which you're going to have to remind me, because I forgot what that acronym is. And you guys are always good about reminding me. BooBoo Kitty, it's scary. And Teresa Nito, Good. We have a good group there. So I like this new program, except for not being able to look at you guys. But I do like being able to throw up the lower thirds. I also have the ability to put up these screens like this so that you can see that. Actually, I'm not sure if it's coming up right now because of the delay. Yeah, it's coming up now. So I can put things like this up so that you know, I can pick my nose or whatever it is I'm doing, so that okay, and then the lower third's not there. I was going to let you guys know about tomorrow's video. It is a little bit of talk about something we talked about on the live videos, the Burning Man Festival. Not a whole lot of talk, just a little story. And then I show a picture, which the patrons have already seen because it's on the Patreon. And then coming up next Tuesday, another Dr. Gawain. This time him getting a foreign body out of a patient's hand. So that one's an interesting one, especially since we did not see the foreign body until we went back and looked at the video afterward. Interesting. So it kind of changed the whole way that the video goes compared to what really happened. And I can let you guys know that. Okay, back to your comments. Where's Dr. Eye Candy? He is at home with his family. He's not doing the live video tonight, but you can always read his blog at drgreenknight.com. This week's was on de-prescribing, which is inspiring to me also, not only to his other readers who aren't doctors. Weight versus fertility. Yes, if a person is terribly underweight, they will not have menses. And when you're not having menses and putting those eggs out there, you're not having the ability to get fertilized. So that can happen when people are not eating adequate calories for their caloric output. You know, if they're exercising too much or eating too little or some combination of the two, that can be a bad thing. All right. Well, let's go back to the comments here. Oh, BooBoo is just having a wonderful time giving BooBoo advice to all the other people. That's good. I never addressed using the caffeinated beverages for migraine. I've never seen it recommended as a preventive. In fact, anything but having a daily caffeinated beverage, I would recommend against, especially when it comes to headaches or migraine, because of withdrawal headaches, which happen when a person has a regular intake of caffeine. When they miss it, they get headaches. This also happens with analgesics, ibuprofen or Tylenol. People use it every day. This will happen with some people with headaches. And then if they miss it, they get a headache from a analgesic withdrawal headache from the not getting it. So when people are having problems like that and they're having to use a lot of these medicines and there's a headache issue going on, we'll recommend that they rotate them. You know, take one for a couple days, take a different one for a couple days, come back, maybe even take 3 different types of medicines if you can for the whatever it is, whether it be headache or migraine, whatever. But caffeine is a good treatment for headache. The over-the-counter product Excedrin actually has, I think, is it 30 or 60 milligrams per pill or capsule, and you take a couple of those to get a total of 60 or 120. I think it's a total of 60. And the other ingredients into it are equivalent to a couple Tylenol and a couple of, I believe it's a couple aspirin, regular aspirin, which is great medicine for when somebody's having a migraine. Of course, the best treatments for migraine are abortive, getting rid of it, aborting it before it becomes a full-blown migraine. That's ideal because that way you don't have to feel sick, and usually those types of treatments are more effective. And then there's people with such bad ones that they have to do preventive medicines like injections like Botox, or there's some other daily medicines people will take, some blood pressure pills, some anti-seizure medicines. These are all things that can help people who have a horrible problem with migraine not have to have it. But you have to imagine it's a pretty bad situation when you have to take a pill every day to keep from having it. And there's people like that. And there's also injections for acute treatment like we do, like the nerve block injections, the greater occipital nerve, lesser occipital nerve, and that one video that shows getting an effect with the dorsal occipital nerve. I think there's a couple videos, if not a couple of videos, one really good one. And we've had other cases that were just remarkable, just like the one you saw. One that I really wish that we got on video because it was just amazing. Well, the one that we got on video was pretty amazing. If you guys have seen that, the greater occipital nerve block for migraine, where she is just so overwhelmed with how wonderful it is to have a migraine go away like that with a shot. And it was pretty cool to be a part of that. I recommend you guys see that if you haven't already. I'm not sure, I think it's maybe it's called Migraine Cure. Anyway, if you just look at Auburn Medical Group and search for Auburn Medical Group and migraine on YouTube, you'll find it. I wanted to let you guys know I'm trying to simultaneously stream our video on Facebook also, but for Facebook Live. But I tried it tonight and I couldn't get it to work, so I don't know that that's possible with our setup. I know some people do it, but we may not have exactly the right system for that. That's okay. We're doing very well with YouTube alone, and it looks like we're having a good number of people. Do you guys see how many people are on? I don't think you guys do you? Okay, going back to the chat here. See, there you guys are. You can see the delay. Quite a delay, isn't there? BooBoo saying she loves the blog. Oh, also, you guys make sure I know if anybody does a super chat, because I don't want to miss those. Pamela Schramke, caffeine once I have migraine, otherwise 100% caffeine free. Give it 2004. Kelly likes dark chocolate. Laura E. does Botox for migraine. It helps, but isn't it poison? Absolutely, along with all the other medicines we're prescribing you. Audrey Bunch, coffee instead of Mountain Dew? Yeah, you can do that too. It's easier to get higher caffeine with coffee because you just get stronger coffee than the Mountain Dew. BooBoo, my friend, was advised to drink Dr. Pepper when she has an asthma attack. The effect is so minimal. We want people using real asthma medicines to get, because we're talking about airway here. Don't mess around when it comes to airway. Use the albuterol inhaled. Don't, if you're actually having wheezing, because wheezing is just a little step of a process going on with the swelling in the airway. And when it gets big enough, no air is getting through. And that can happen like that. And it does. And it happens as often in people with mild asthma as it does in people with moderate to severe asthma. So with the death toll being as high in people with mild asthma, we don't mess around with wheezing. We get rid of it. This is coming from a guy who tried to intubate a 12-year-old who had his inhaler in his hand. And we could not get the airway into him fast enough because he was already gone when we got him on the table. That was a terrible tragedy. And it was because we didn't have adequate, or whoever was treating him, well, I shouldn't say this, but it could have been because he didn't have adequate preventive therapy or maintenance therapy. This is why doctors are trying to get asthmatics who have more than just the occasional symptoms resolved very easily with their inhaler to be on medicines that they take daily to control the medicine. Here I am prescribing medicines again, going against what Dr. Gwynn said. See the trouble? See how hard it is to promote health without prescribing? The two come into conflict quite often. Okay, back to your comments. Pamela Schramke, my friends, abortives do nothing for me, so I had very different medication. L. D'Angelo, type 2 diabetic, craves sweets, ate a small amount of dark chocolate. Good. We're having quite a bit of the cocoa here too. Cocoa being pure cocoa, dark chocolate usually being like 80% or whatever dark. And the reason we're doing that is because we don't want any, I don't want any milk. LeeAnn will still have a little bit of it. And I don't want any sugar. And so when we'll make dessert, it'll be cocoa and peanut butter and bananas and some mixture of those and maybe some other nuts. And we're making some interesting things by using those in different combinations or freezing the bananas. And this is dessert tasting stuff. And it is sweet because bananas are sweet and have natural sugar in them. So, and then you get the cocoa in it and mixes well with the banana, so you don't need milk chocolate. You've got banana chocolate. And I don't want to promote any of these foods that I've been discovering as alternatives to a particular food, like the veggie burger instead of a hamburger. No, we want foods that are their own thing. So we're discovering new combinations of foods, new desserts, not substitutes for the old stuff. And it's a wonderful adventure. And yes, taste does change over time and it's going to taste better as it goes. And this does take months for your taste to change when you start eating healthy. But good things come from it. Weight loss, I've lost easily 6 pounds in the last 3 weeks. And I'm not limiting the amount of food. It's limiting what kinds of food, and finding I really enjoy some. But of course, sometimes some of the vegetables, just a mouthful of vegetables, gets old. So that's happened with some of the dishes. That's okay. I'm okay with that. But we have other things that are good. And it's wonderful to be able to eat the dried fruit without added sugar, just fruit, and the not roasted, not salted raw nuts. And if you put them in the right mix, it really gives it a good flavor. Because you do miss the flavor if you just have raw unsalted nuts by themselves. They don't taste as good as the roasted and salted ones. So you put them together with some of the dried fruit. You get these really good trail mixes that are satisfying as the food you used to eat. Okay, back to your comments. And you saw that it says 26 people. Where are you guys seeing that? Okay, if I get rid of the live chat, does it come up? Oh, okay, yeah, it says 30 watching now, and then I tap that there to get the live chat back. Okay, thank you. Yes, I see how to do that. And it's funny, I get a little different number when I look at that than if I look at the program. Oh, I haven't shown you guys what it is. It operates off of an iPad. So you guys are seeing this well after the fact because of the delay. So I'm going to try to demonstrate like some of the things we do here. So if I want to put the screen there, the Auburn Medical Group screen, I'll go like that, and then that will be what you see. Of course, you can't see what I'm doing anymore, so I need to go back. There we go. And if I want to put the lower third, I'll touch on this, and then I'll touch on this to bring it down. There we go. Oh, actually, you weren't seeing all that. So there's the lower third. If I want to get rid of the lower third, I just tap it here to take it away, and then bring this back down. And it switches back to not having the lower third. So lower third, for those of you not in the broadcasting or video world, that's where you have that little thing that goes across the bottom of the screen that says something on it that, like somebody's name. And actually the one I have, I probably need to position differently. I probably need to lower it a little bit and make it a little bit bigger there. How about like that? Do you like that better? Yeah, I like that a little bit better myself. And then I can just take it away just by hitting it and going back to the regular. Hey, I thought I could just hit that. Okay. Let's just X out. And there we go. Now we're back to normal. Okay, back to your comments. Audrey, slight sunburn? No, but I might look kind of red here just from the lighting of the lights, especially with all the orangish reddish stuff around here. I think it gives more of a red. I do look rather ruddy today, don't I? Something's going on. Oh, it's really hot in here. That's one thing. Even though it's cooled down a little bit, finally it's not 100 degrees. It's still really hot in our house. We don't have the air conditioner going right now. Grimfix, so excited. Your live session, BooBoo. Ate a peach before I drink the chocolate syrup. Working on the healthy thing. Interesting, BooBoo's joking, but interesting thing. And again, I'll say Joel Furman's name, even though I have issues with a lot of what he says. But one of the things I really like is he talks about a balance of micronutrients to calories, this so-called nutrition quotient. So that it's not necessarily what particular foods, it's the balance of the foods overall, how many calories you're getting, how many nutrients are you getting in the foods you're eating. That is important. It's not the end all of nutrition, but it does make the point of having a little something to make your food a little more palatable. There's a place for that. And I'll have a little bit of stuff, that I wouldn't be on my list of foods to eat, but have it together with other good foods to make it deliverable to the taste buds. Don't have to do as much of that now. The more I've been doing it, the less I have need to have a dressing that is something other than oil and vinegar. It's been getting better. Back to your comments. Grim Fix lost 20 pounds in 6 weeks. Wow. Miranda, what is Neurontin? Jessica Palmer, who do you as a physician go to for nutritional advice? Why are people not screaming about processed meats as carcinogens? Janet, I'm going to give you a little bit of attention here because I agree with you. Why aren't we? Why is it the World Health Organization has processed meats listed as carcinogens? Processed meats including pepperoni and bacon, along with some lunch meats, a lot of lunch meats. And we're just not seeing it here. And we're still getting government dollars going toward, through the USDA, to promote the eating of beef, and which is in a lot of the processed meats, and other agriculture councils promoting certain foods, dairy council, foods that we don't necessarily need. They even get on the food pyramids or for food groups or whatever. And it's lobbyists that are accomplishing this through the USDA. It's not coming from the NIH. If you look to them for nutrition advice, you're going to get something different. So I'd recommend looking at the NIH. Honestly, I haven't done it myself. Feel a little remiss there. You caught me off guard. That would be one place. I will say that from my knowledge and study on nutrition, the material that Dr. Joel Furman, is putting out actually is pretty good nutritional advice. Don't listen to his other stuff and don't buy any of his supplements. But his diets and his recommendations, he's got some really good stuff there. And I'd love to have a conversation with him about this, very honest, open conversation about, don't disparage conventional medicine that has its place, because diet isn't everything. And don't, what's the other thing that I don't like? Oh, that he's selling the supplements. I know it's his living, but really, I like when he says that you don't need to have those things, but then he sells them, so I'm a little concerned about that. Probably shouldn't be talking this way about a person I'd like to collaborate with, huh? Yeah. Well, okay, back to your comments. Avoid all processed foods when possible. Yes, LB, absolutely. Read labels. See what's put in them. See that they're not adding something to your food. If I had a little label here, I'd grab it and show it to you right now. But get food wrapped in this kind of stuff here. As one patient put it, we no longer have food in our house, just ingredients. Kelly Alonso, avoid nitrates. Yes, do. Grim Fix. A lot of other countries don't allow high fructose corn syrup and other junk like that. Yeah, I'd avoid that. Of course, I'm not a super fan of just having, they're putting everything now to make it look like it's not high fructose corn syrup. Instead, they'll put cane sugar in. Avoid it. Just get some real food. You don't need something that has cane sugar in it either. Eat in moderation. Pamela Schramke, I've lost weight since we started eating Hello Fresh. We still love it. Good, Pamela. BooBoo Kitty, I eat 3 pieces of bacon a week. No cold meat, no soda. Try to cook meals at home nightly. Denying yourself junk food makes you want it more. Is that true? Makes you want it more. It takes a long time to get away from the junk food. It is a hard process to get away from an addiction. Whatever that addiction is, when it has a hold on your neurotransmitters. So yes, you do want things when you're depriving yourself of them, especially if it's on your mind. You got to get your mind on other things, find other things to eat. And it's hard to eat healthy when you've grown up eating the typical American diet. You're not familiar with using foods in these ways. Your house doesn't have these foods in it. It has things in packages instead. So it's not an easy thing. And this is what I'm running to. I told you about the one patient this week who got off blood pressure medicine. That's in contrast to another patient who just wouldn't hear anything I was saying. And I've learned not to even try it. If a patient's not hearing me, if they're not ready to change, it's like quitting smoking. Why waste your time? They need to be at a place where they have this realization. I like to say that I had a conversion experience while listening to somebody interview Dr. Joel Furman about 3 weeks back. And that really is what it was. The information now strikes me differently. It's not stuff that's new to me. It's just put in a way that it finally clicked, that I finally saw these foods as bad. I mean, really bad. And saw good foods as good, and realizing good foods can taste good. But it does take time to make that adjustment. LB, if diet isn't everything, what do you mean? What was I saying? If diet isn't everything, diet isn't everything. Okay, yeah, it was a comment Dr. Furman made where I think he would deny it if a doctor confronted him on it. But if you listen to that one podcast I listened to, I think it's called You Made It Weird, he you can't come away from that and not think he's saying there would be no cancer, diabetes, hypertension if people ate the way he recommends. And that's just not true. BooBoo. Thought the HelloFresh is as good as it claims. Kimberly Mikolachak. Still stick a piece of bread and pull the back of your throat and swallow and drink really fast. Okay, I don't know what that is. Doritos, Oreos, Dr. Vaughan. You know you want them. BooBoo. I'm past it. I can actually walk by them. In fact, 2 mornings since I've changed this, there have been donuts in the office and I didn't have any. And there were, well, one time I looked, and then another time I didn't even look, didn't even go. Oh, and somebody brought cupcakes today, and I did see them, and they were quite decorative, pretty to look at, but I didn't have them. So I'm feeling really good about this. Feeling really good. All right, Grimfix, Pamela, my husband would keep ready in case troubles. Hey, can somebody do a super chat? I don't know what it looks like on this, and I'm just curious to see what it looks like. Jesus Rivera Torres, doctor, what is the best way to take pills because I'm afraid the pill will get stuck in my throat? Lots of water. BooBoo, Andrea, good question. Oh, okay, that's what somebody was talking about, sticking in your throat. Okay. Tammy Fox, had a doctor tell me stop eating when you start to feel full. Don't finish what's on the plate. Yes, that goes against what we've grown up being told. What's on the plate? You will lose weight. I did, lost 185 pounds. Wow, Tammy, that's incredible. Congratulations. Kimberly Melanchik, or actually, I'm pronouncing your name wrong because everybody pronounces your name wrong. Big junk food junkie, and I love chocolate chip cookies. BooBoo, proud of you, Dr. Vaughan. You're doing it. Thank you, BooBoo. Your encouragement means a lot to me. I'll have to call you next week and get more encouragement on our Google Hangout. And why does BooBoo get a Google Hangout with Dr. Vaughan? Because she's a patron on Patreon, Auburn, or patreon.com/Auburn Medical Group. There, that was my commercial. LB, donuts are my kryptonite. Yeah, it was a decision not to have any. It was, I'll tell you. But it's getting easier. As it goes, it's getting easier. There's something empowering about having said no once. And I guess anybody who's worked with an addiction or had this food change would probably agree with me that to find out you can do it and you really don't miss it after you do that a number of times. It's not as hard each time you go because oh, that's another thing about eating good food. Dr. Furman talked about this on the podcast. As you do it, it's not as hard to get away from the bad stuff, and it starts to taste better. The good foods start to taste better. So it gets better as it goes. And so once you reach a certain critical mass, so to speak, you just start rolling and it gets better. Okay, so where are we here? BooBoo. Andrea had a question about protein. Well, let me go back and read her question about protein. So Andrea, was it a super chat? Andrea, doctor, in my mid-50s, is it best to get most of my protein in before noon? Okay, time of day. There is such conflicting data about time of day. I have seen studies that just say absolutely opposite things. And I've had people who work with me promoting these ideas to patients, and I looked at them and realized this stuff is contradictory to itself. Don't give patients firm recommendations on this. I'll give you just some broad strokes here. And that would be to try to get most of the calories earlier in the day so that you can use them instead of having to go into storage. And I will say there's even some research that even suggests not doing that. As far as a certain amount of protein in a certain part of the day, I have no knowledge of good data one way or the other. There could very well be, and I'm just not familiar with it. But definitely overall, we don't want you eating right before bedtime. That's a good conclusion there. I don't know of anything strong about having more protein in a particular time of day, though. Okay, so that addresses the protein question. For Andrea, Kelly Almazo, just want to tell you I love your... Oh, thank you, Kelly. That's very kind. El Diagello, I like smaller plates, smaller meals with my diabetes. That only works if you don't get seconds and thirds. Personal experience talking. Kimberly Malachek, thanks, Dr. Mark. You're pronouncing my last name right after my... I am not pronouncing your name right. I'm just saying it like some family here in town, the Malacheks. McCullochek. It's got an M followed by an N. Do I pronounce both the M and the N? McCullochek? Will that work? McCullochek? Okay. And hello to Sharon. Sharon, have you been here the whole time? Did you just get... No, you've been here. D'Angelo, never. Pamela Schramke, Grim Fix. That's terrible. I totally understand, though. I actually have the same issue from GERD being improperly treated for years. I actually have my esophagus stretched every other year. Oh, man. The boogie's going down and stretching. Oh, man. Small plates and eat with chopsticks. with your non-dominant hand or foot. That'll cause less caloric intake, won't it? Nice, boo. Grimfix, Dr. Vaughan. Have you noticed that people are more vitamin D deficient? I know farmers with vitamin D deficiency. I've brought mine up from 1. Oh my goodness. Yeah, the vitamin D deficiency is kind of a strange thing. I'm not sure what the full story is on that we see so much vitamin D deficiency. I often am telling patients we don't have to check vitamin levels because we don't really have vitamin deficiencies except for people with particular medical problems. The exception being vitamin D deficiency. And it's surprising how much there is. We find that if we supplement vitamin D, we actually have a significant number of less falls in people who get the vitamin D supplementation. Not sure of the explanation for that, though I'm sure there is one. So yeah, why is that? Is it that we're not getting as much sun exposure? And I think we're seeing it in some people actually are getting a fair amount of sun, and people are having their milk fortified with vitamin D and other things. So. And I'm not recommending people go to the milk to get their vitamin D because it's fortified. It's not naturally in the milk. I'm also not recommending that we all go sunbathing to get it, even though that's the natural source of vitamin D. It's one of those where I'm actually, here I go again, telling people to take a pill. When will it ever end? Okay, back to your comments. LB, I have GERD, finally managed to get under control. Sharon, I missed a few. Pamela Schramke, my vitamin D was only 12. Oh my goodness, you people with low vitamin Ds. My husband was 6. We had no clue we were so low. Pamela, I'd like to be reminded where you live because I would expect the more problems with vitamin D to be in places with less sunshine. May not be true. Just curious, since it's both you and your husband. Because you're probably not related. TC in Canada, moderation and everything and less eating out. Yeah, eating out is a challenge to eat healthy, I'll tell you that. L. D'Angelo, take vitamin D supplement. Yeah, that's kind of what it comes down to for a lot of this vitamin D stuff. I hate to say it, because I hate the idea of taking pills. That's why it's so frustrating to be a doctor with patients who won't change their lifestyle, so they don't have to take pills. And the ones that do change their lifestyle, it's very rewarding. I'm hoping that, we do the videos, the ear and the dilated pore whiner, and they're kind of cool to see. They get a lot of views on YouTube, which I'm finally reaching a place where I don't have to have all the views and get all the subscribers because I'm kind of reaching a milestone that is very satisfying, almost 100,000 subscribers. So maybe I'll be a little more comfortable not feeling a push to do things that get views and going ahead and talking more about things like lifestyle to try to make the world a better and healthier place. Maybe that would be a good thing to do. I won't get as many views. I'm okay with that. I've almost got my 100,000, so I can go ahead and do stuff that's actually going to make the world a better place, and it feels good. Okay, we've got warnings about low battery, so I probably should wrap up. Let me borrow the power from this. Oh, you guys fell down again. I'll pick you up, don't worry. If you still work. I don't know if you still work. You still work? Are you there? Hello? Is this thing on? Wow, that was something. Okay, so with our, if that happened, been the end of the show, which is probably ending very soon anyway. Okay, is it upright? Because I actually put the phone back in upside down by accident. There. Oh, now you're over here. I need to look over here. And look, it's upright, even though I put the phone in upside down. Okay, so I'm going to, I need to wrap it up because I'm throwing things around and breaking things. But boy, do I appreciate you guys. We don't usually go this long if you're new to our live YouTube. Usually it's much shorter. And generally what kind of drives how long they'll go is how much fun it is. You know, if you guys are having lots of good questions and we're having good discussion, and if there's super chats, it's more interesting and more enjoyable on my end. I'm sure it is on your end too. And so look at that. You guys can see where you are. You're up in the mug cabinet here. Can you guys usually see that, or do I usually have it more angled like? I think I usually have it more angled like that. So do continue to watch the videos. If by chance there's someone that's watched this video this far through or been part of the live and you're not already subscribed, I don't know how you do it. And turn on the little bell icon. Can I show the bell icon? Because I have this here, maybe I can. Where's the bell icon? So if you're watching on your device and you have this little bell icon here, you need to tap that and set up your settings for notifications so that you can get notifications when these live occurrences occur. Also, you may not know it, but we actually do have, thanks to Omar in New Jersey, an Auburn Medical Group fan page on Instagram called Auburn Medical Group fan page. And then we do have a Facebook. It's called Auburn Medical Group. There's a page there, which I almost live broadcast to tonight in addition to YouTube, but I don't know if that's actually going to be a thing. I'll keep playing with it. Does that cover everything? Oh, drgreenknight.com for Dr. Gwain's blog. I should direct you guys to that. And also tell you to share things like this with your friends who might benefit from it. Although I don't know that I'd watch this whole 40-minute long thing for a little bit of diet advice, but maybe it's motivating to somebody. If it is, great. And if it's helped any of you, please let me know in the comments, because the comment section will be open to this even after the video is no longer live. And those of you who are watching this after the fact and got this far and wonder, how am I talking to people? It's because when this comes out live, people can actually chat with me. All right, let me go back down to the live chat just to get one last look at you guys. Oh, Omar's there. Omar, thank you. See, I'm promoting your Instagram. Omar actually runs that Instagram for us, the Auburn Medical Group. So yeah, okay, Omar's there. Good night, funny. Closes cupboard door. Oh yeah, that'd be a good way to end the show, except the mic's sticking out. Thank you from Audrey. Omar finally made it to chat. If we go long enough, Omar makes it. BooBoo, hi to LeeAnn. She's in another room. I don't know if she's watching. Omar, it's going to end me. Okay. Can we do this? Let's try it. Let's see if this works. This will be fun. All right. Here we go. So, Dr. Vaughan telling you to stay in good health.